A hunting expedition in Rio de Janeiro. Every week, teams of health agents patrol the streets, leaving no stone unturned, knocking on 300,000 doors, looking for an almost invisible enemy, the Aedes aegypti mosquito, responsible for spreading dengue fever. It lays its eggs mostly in still clear water.
We check everywhere. The water tanks, gutters, pools, making sure the places are dry or shut.
With over 1.3 million infections and more than 300 deaths, Brazil is facing a dengue fever epidemic. At least 9 states, including Rio de Janeiro, have declared a health emergency. The mosquito-borne viral disease is so painful it is known as breakbone fever. 20-year-old Yara Lima tells us she woke up with a 39-degree fever, swollen eyes, nausea, and joint pains before rushing to the hospital. Hospitals are so crowded with dengue patients that health centers like this one have been opened just to deal with the epidemic. This year, Brazil has become the first country in the world to include a Japanese-made dengue vaccine in its public health system. But there are only enough doses to distribute among children from ages 10 to 14. Doctors here tell us that they're bracing up for the worst. Dengue infections in Brazil have not yet reached their peak. That should happen in the next few weeks or months. Specialists say global warming and climate change have contributed to the surge of dengue fever, common to tropical and subtropical countries.
Rainy seasons are rainier. More water and more heat help increase the mosquito population. We are also noticing that the dengue mosquitoes are adapting to other environments. They now reproduce in clear but also in dirty water.
The health ministry has warned Brazilians that dengue cases may increase to 4.2 million this year. That is more than the amount recorded in 2023 by the Pan American Health Organization in all of the Americas. Monica Yanakiew, TRT World, Rio de Janeiro.